want health care?
Why do we want healthcare? Because in this city, a great number of people are uninsured. Charity Hospital, which was the primary hospital in New Orleans, has been closed since Hurricane Katrina. New Orleans really is like, one of the centers of the healthcare crisis in the United States. I work at a community clinic. That's a free clinic. That's a clinic of last resort for a lot of patients because they are being turned away from the emergency, being hospitalized, turned away, they don't have insurance. So it's a crisis, not just for your physical health, but also for mental health. There's very few resources for mental health.
Okay, I say this lady, I see the sign right there, it says to reopen charity. Why would we need to reopen charity when we all are going to have free health care now?
We're not going to have free health care.
Well, I understand, but I mean, we're all going to be insured now.
We're not.
Okay, so you're not happy. Are you happy with the health care bill that we just passed, or are you unhappy with it?
It's better than what we had before.
Okay, why is it better?
But it's still a Band-Aid.
Okay, what would you do to solve it?
The single payer option is good. Also, we really need to have a universalized system. We use taxpayer money for, the prison industrial complex, the military industrial complex. If we started diverting even a little bit of that money to our healthcare infrastructure.
So, are you suggesting that we need to do a lot more to the healthcare system, or do we need to do a lot more with the healthcare system? Make a lot more changes, or just a couple more changes?
It's not. I don't think it has to do with the number of changes. It has to do with the amount of people that are covered, and more people everyone needs to be covered. Every single person. And it shouldn't be, also with being covered, it shouldn't be a degrading process. You shouldn't be marginalized. You shouldn't have to go through all kinds of, invasive questions about your income, your nation of origin, like all these kinds of things. It should be free, on-demand healthcare for everyone in the United States.
Okay, do you think doctors are overpaid?
I don't think that's necessarily the issue. I think, no, I wouldn't necessarily say they're overpaid. I think there is enough resources that the state has on hand, that is resources they have because of the taxes they have on the people, and people have to pay taxes, but you can't choose where the taxes go. And I think a lot of people in the United States, while we're being taxed, would rather that we have health care and that we have education instead of continued military adventures in the Middle East, and instead of maintaining the largest prison population in the world.
Okay.